Hi, I'm Pier. I am the CEO of Regeneration Clinic of Panama. I'm here with our medical director, Dr. Javier Garrido, otherwise known as Dr. G. We are going to talk about stem cells today.
Perfect.
Okay, so I just want to have a few questions for you. Very basic to start with. What are stem cells?
Stem cells, I think I love how it sounds in Spanish because in Spanish is mother cells. Okay. So basically stem cells are the mother of different types of cells. It's the cell which other different lines of cells get produced from. So it's basically one cell that is able to produce different types of cells.
And why do we need them?
We all have stem cells in your body. So basically that's how your body forms, from one major stem cells. But in every single tissue in our body, we all have stem cells. Why do we need them? Because they are the ones that maintain and repair your body, basically.
Okay. I remember before I was involved in biotech industry, I didn't know the difference between embryonic stem cells and the type of stem cells that we use now for therapeutics. Can you explain the difference, please, between those type of cells?
So we have different sources of mesenchymal stem cells. The ones that come from embryonic stem cells, they actually come from embryos. So under the current guidelines, the International Society for Stem Cell Application recommend against the use of embryonic stem cells for two main reasons. One reason are the ethical implications. Where are you going to source a continuous, source of embryos? And secondly, they have an unpredicted and aberrant replication. So you cannot
So they can become tumor forming.
They can become tumor forming. And the type of tumor known as teratoma, which are these tumors that grow hair, grow teeth.
Okay. And why are MSC stem cells or mesenchymal stem cells the preferred choice for safety and effectiveness in this industry?
So the good thing about safety regarding the umbilical cord mesenchymal stem cells is it has the highest amount of published studies regarding the safety, tolerability, and efficacy of all of the different types of stem cells. Regarding the efficacy, it's much more effective than other type of stem cells because it's are the youngest type of stem cells with the highest safety profile. Other type of stem cells would be your own stem cells that you can get from the bone marrow or the adipose tissue.
Could you explain that difference between our own types of stem cells, like the autologous stem cells versus the mesenchymal stem cells that we use here?
Of course. Autologous stem cells are stem cells that we can get from our own body and then use them for the treatment. But there's a couple of setbacks. One would be that those stem cells would basically be as old as we are. They will have the same exposure or toxic exposure as we have had throughout our entire life, and which each year our stem cell population declines. So it won't be as effective if I try to harvest from my bone marrow or from adipose tissue. I won't be able to get as much stem cells or stem cells as potent as if I get from an umbilical cord.
Okay. What makes our approach here in Regeneration Clinic unique to other clinics all over the world?
I think one of the things that I pride myself most of our work here in Regeneration Clinic is that this is not a drive-through stem cell clinic. Most stem cell clinic, if you look, you research, or you talk to them, you come over here, they put stem cells, and then off you go. Over here, we do need to see the rest of the patient, the rest of you. If you come with an autoimmune condition, I need to understand all of the known contributing factors to that condition and tackle each and one of those. Because if we want to have better, longer lasting results, we need to see you and treat you as a whole.
What does the in-house lab versus outsourcing contribute to the quality and efficacy of our product?
Having our own lab right here across the hall from the clinic give us a lot of positive things. One of those, we are able to oversee, and guarantee the quality of the product. And we have the shortest time from the harvest to the application to the patient. It doesn't need to sit through traffic. It doesn't need to go through cryopreservation. We get the fresh stem cells and we apply it right away.
And after you're done doing these treatments and these therapeutic treatments that you're doing, what is the type of post-care that is involved with the patients? What can they expect to receive from us?
So from us, at the end of your stay over here, one of the things that we would do is basically review all of your medical condition, and we would go over with you a personalized treatment plan, right? Action plan of things that you should do once you get back home. That is going to depend, on a patient to patient basis. It's going to depend on your condition, on your background, and on your goals. What can you expect from us? We do follow-ups with all of our patients every 3 months in order to reassess their condition and in order to see we need to redesign the intervention.
Okay. Deviating a little bit here from that topic, what are exosomes and secretomes? I know that we use them for therapeutics, but how are those different than stem cells, and why do we use those in Regeneration Clinic?
Okay. That's a very good question. So the thing about exosomes, it's something that we all should be wary about because there's a lot of product that state exosomes, but do you know which cells produce exosomes?
No.
Every single cell
In your body
produces exosomes.
Okay.
So it's not the same thing, a umbilical cord derived stem cells exosomes than just exosomes whatsoever. So it's very important. If you see exosomes in the label of something, you should find the source of it. You should see where does it come from. The main difference about secretome and exosome, secretome is the mixture of all of the bioactive molecules that are secreted by the stem cells. That's why the term secretome. All of the bioactive molecules secreted by stem cells. Within the secretome, you have the exosomes. Exosomes is basically a exo, outside, some, a body. So it's basically an extracellular body, a vesicle that goes outside of the cell.
And why are these more effective or less effective in therapeutics than stem cells themselves?
So they're not less effective, but they could have a faster reaction, basically, because the exosome is made to be a cellular to cellular communication. Basically, if I am the stem cell, I release the exosome and give you an instruction. You receive the instruction directly. So you're going to have that effect, that anti-inflammatory effect, or that regeneration property, inducing property, much faster than just applying the stem cells.
And what type of therapeutics would you use secretome and exosomes for?
What we use it mostly is for sports injury. We can do it for muscle recovery. We can use it for joints and from spinal cord injuries. So whenever we do the intrathecal approach, which is like the spinal tap or an epidural, we can take advantage of these secretomes and basically have a very concentrated amount of all of these growth factors into a very small volume and apply them into the cerebrospinal fluid. That opened up a treatment for different type of conditions, from neurodegenerative conditions as Alzheimer's, Parkinson, dementia, from stroke, TBI, or spinal cord injury as well.
Okay, that leads me to my next question. What types of different applications can you do? Intrathecally, you mentioned, intramuscular, intraarticular. Can you please list them all if you don't mind?
Of course. So the main one is for a systemic approach. That could be an intravenous approach. And then we jump to direct applications. With direct applications, we can apply them in the joints, in the tendon, wherever you have the injury. We work with different type of spine surgeons and also work all the different levels of your spine, from the disc, from the facet joint, for the vertebrae, and the deep tissue planes in order to reduce inflammation, improve the recovery.
What qualifications or what criteria do you guys use to determine whether somebody's a candidate or not for certain types of applications?
For most conditions, you already have different type of rating scales, basically. So one of the things that we wouldn't recommend stem cells to certain patients would be whenever we are at end stage of the disease. Whenever you're at the end stage of the disease, there has been shown that there's very little recovery that we can get. So we could be able to maintain the patient or have some type of recovery, but the ideal moment to do or get a stem cell treatment whenever you have a condition is to be as soon as possible.
Okay. The longer it goes on, the harder it is to
recover.
Okay, understood. Can you explain to us a little bit about how stem cells work in the body, the anti-inflammatory and immunomodulating effects that it has?
Of course. So stem cells are known for two main properties. One is their immunomodulation, and the other one is their regenerative properties. With the immunomodulation, the stem cells work directly with your immune cells. So we have like 5 main different types of immune cells, and the stem cells interact with each and one of those, changing from a pro-inflammatory state to an anti-inflammatory state in your macrophage, working with your dendritic cells, with natural killers, lymphocyte B, lymphocyte T. So it basically shuts the inflammation down, switches to an anti-inflammatory state, modulates your immune system, your immune response, and creates some immune tolerance.
Why is it important to regulate the inflammation inside of a body? Why is that an important thing to do?
So the inflammation is the root cause of every single chronic disease. So wherever you have inflammation, you're going to have 5 pillars. So these are the 5 main pillars of inflammation. Imagine if I fall down and I hurt my knee. My knee is going to have inflammation. It's going to have these 5 things. It's going to have pain. It's going to be swollen. It's going to be warm. It's going to be red. And the 5th pillar of inflammation is loss of function. I won't be able to fully extend my knee or fully retract my leg. And if I walk, I'm going to be limping. So wherever you have inflammation all over your body or systemic inflammation, you will have loss of function in different types of tissues. This accelerates the aging process. This increases your chances of chronic conditions and increases your chances of cancer. One of the hallmarks of aging, which is all of the known processes that contribute to the aging, is chronic inflammation, also referred as inflammaging.
That's why the anti-aging protocol for stem cell therapy is important, because it would reduce the inflammation systemically within the body and therefore wait off disease for a longer period of time. Is that right?
Correct.
Okay. What type of conditions do we treat in the clinic? I know we've done all kinds of things, from autism to autoimmune diseases to anti-aging to orthopedics, neurological. What type of diseases do we specialize in?
So we do have a very unique protocol for autism, which is called the ABC for autism. The ABC protocol tackles, again, all of the different known contributing factors to autism to this day. And it's a very comprehensive protocol that usually lasts from 5 to 4 weeks. And we tackle from the gut, from your immune system, from brain stimulation, and the stem cells. Stem cells, we do it for modulating the immune system as well, and for the regenerative properties for the brain. That's for autism. With sports injury, we've had great results. We do direct applications into different type of joints. We mix them with different products to provide better, longer lasting results. We have treated spinal cord injuries with amazing results as well. We do have a testimonial of a patient. He was with a car accident. He was in a wheelchair. He could not walk. He could not stand up. He could barely move his legs. And he just sent us a video of him walking.
So that was going to lead me to my next question. What are the most amazing results that we've seen here in the clinic? Success stories such as that.
Claro. So I think this is a very good case of success story, because whenever you have spinal cord injury, the prognosis is very poor. So especially in this case, he had a high level spinal cord injury that affected both of his arm and both of his legs. He didn't have bladder control or bowel movement control. So he had a car accident in February of last year. 8 months later, November, he comes to the clinic, and we do the intrathecal approach and the IV approach. With the intrathecal approach, we did a mixture of stem cells and the secretome.
Was he walking during this?
He could not walk. He was in a wheelchair.
He was wheelchair bound?
He was wheelchair bound. He could not walk. He could not stand. He could barely move his leg or feel his leg.
Mm-hmm.
And now it has been 5 months since his first treatment, and he sent me yesterday a video of him walking.
Okay.
Why is this so impactful for us? Because in medicine, whenever you see spinal cord injury, that's it.
It's over.
It's over. There's nothing we could see, nothing we could do.
And how can we be sure to attribute the success of his recovery to the stem cells and not some other natural factor that might have happened?
So he already had physical therapy for over 8 months with little to no improvement. And whenever you saw it before and after from the stem cell treatment.
Oh, I saw. I want to tell everybody else.
So there was a before and after. So within a couple of months, 2 months after the first treatment, he was already standing and using a walker.
Mm-hmm.
So in 8 months or 9 months of physical therapy with very little recovery or no recovery at all, just after the stem cells, in those first 2 months, we saw drastic changes.
Okay. Let's change the subject here a little bit and talk a little bit about other advanced therapies that we have in this clinic, such as NAD. What are Nakamura factors, things like this?
Mm-hmm. Perfect. So NAD is one of the molecules that are all, associated to the aging process. The NAD, you need it for what we call the Krebs cycle, which is the cycle that every cell needs to go through in order to take the glucose and transform it into energy that your body could use, your cells could use, called ATP. In that cycle, you need 3 steps that need NAD. And the thing is, as we age, we decrease our levels of NAD. And with that decrease, we decrease our energy output, the amount of energy that every single cell in our body is able to produce.
Are we able to measure the NAD inside the body?
We're able to measure NAD. It's called intracellular NAD levels. We do have the testing, the specialized testing to measure that over here. And that way we can make sure if the treatment is working or not, and how we need to adjust in order to optimize your NAD levels.
Will stem cells help with that?
Stem cells has been shown to improve the mitochondrial dysfunction. Mitochondrial dysfunction by itself is another one of the hallmarks of aging. So stem cells are known to improve that by increasing the biogenesis of mitochondria, basically stimulating the formation of new mitochondria.
What are Yamanaka factors?
The Yamanaka factors are what we call transcription factors. It's different type of factors that we basically signal your DNA to do something. In this case, we use it it is used in order to get stem cells or any cell from your body, any cell, could be from the skin, and you do what we call an induced pluripotent stem cells. So you get a mature cell, a mature adult cell, you put the Yamanaka factors, and then this cell would basically go back in age, back in time, or back into a previous level, and when it was a stem cell, for example. So the Yamanaka factor has been used for creating what we call the induced pluripotent stem cells. But are other studies that, for example, there was a very famous study done in mice, published last year, that these were blind mice that got injected Yamanaka factors inside of the eye and reversed the blindness. So the theory or the hypothesis was that if you have a very aged, old nerve that was damaged, you put the Yamanaka factors and you basically return it to a previous age where the nerve was young and healthy.
Okay, let's talk a little bit about pluripotent induced stem cells. You just gave it an example there of how to cure basically some types of blindness with this. What other applications do we have? I've heard with diabetes as well. Type 1 diabetes can be cured effectively with these type of cells, correct?
Correct. There was a recent case as well that the scientists got a somatic cell, an adult cell, and they had the induced pluripotent stem cells, and then from that stem cell they induced it in order to be from the beta cells in the pancreas, the islet cells, which are the cells that produce insulin. So they were basically differentiated into becoming that insulin producing cells, and then they were injected into the abdomen.
Directly into the pancreas?
Into the abdomen.
Abdomen.
It's what we call intraperitoneal. Mm-hmm. The peritoneum is everything that's inside the abdomen. So it was not a direct injection into the pancreas or a transplantation into the pancreas. It was just an intra-abdominal injection, and stem cells basically knew where to go.
Okay, so to understand this a little bit better, you inject this intraperitoneal inside the abdomen, and the stem cells find their way to the pancreas, I'm assuming?
Correct.
And do they regenerate into the pancreatic cells, or do they actually tell the body how to turn their own stem cells into those pancreatic cells?
So it depends. For example, whenever you're working with mesenchymal stem cells, mm-hmm. Mesenchymal stem cells basically tell you what to do. Okay. Tell your body and basically give instruction, give orders in order to start the regeneration mechanism. whenever you use induced pluripotent stem cells, by using your genes or basically a stem cell from your own body and induce them, then you could probably become tissue.
So are all induced stem cells autologous?
Most of the time, yes.
Okay, so they're from your own body and just modify them inside of a lab to get the characteristics that we're looking for.
Exactly.
Okay. Why is it, I always hear, my own interest comes from, in stem cells, comes from hearing people like Joe Rogan and Tony Robbins talk about Panama and stem cells. Why has Panama become a hub for stem cell therapy worldwide?
A couple of things. So we have a very privileged geographical position. So Panama, you have a direct flight from almost every place in the Americas. One of the first stem cell clinics in the region was based here in Panama, and obviously that got a lot of attention.
Dr. G, why don't we talk a little bit about our setting here? We are in Panama, the Republic of Panama, not Panama City, Florida. Why is it that stem cells are so prolific here in Panama?
Panama's, again, has a very privileged geographical position. So we get direct flight from all over the world into Panama. Our clinic is right in Panama City, Panama, in the heart of the city. So it's a very, very good location. Here in Panama, we are very Americanized. So we had the American presence for almost 100 years here. So we use the US dollar. There's a lot of people that will speak in English. It's a very safe country. And it's a country that is developing very rapidly. So most of our patients that come from the United States, come from Canada, come from Europe, they feel safe and they feel like home.
Why do you think that it is not approved by the FDA in the United States and people like Joe Rogan and Tony Robbins recommend people to get this treatment abroad?
The FDA currently does not approve mesenchymal stem cells from the umbilical cord treatments because they consider the umbilical cord derived mesenchymal stem cells like a pharmacological product. They consider it a pharmacological product. And as any pharmacological product, you need to go through all the 4 phases of clinical trials. The thing is, you cannot patent the umbilical cord. So there's no real interest in anybody to spend hundreds of millions to billions of dollars in clinical trials that last so long and for so many people.
So it's a money thing.
It is tricky because the FDA does not oversee other cellular transfusions like red blood cells, and we all know they save life. They don't oversee bone marrow stem cells application that they have been the gold standard of care for lymphoma, leukemia, multiple myeloma from the 1960s. They do not oversee organ transplantation, and we all know they save life. So there's a discrepancy of why do you consider this one as a pharmacological product, but the other ones has been not in your regulation. So it is tricky, that aspect. That being said, it's also very important to state that that's not being FDA approved does not mean it's not a safe product, because you do have clinical trials published in the United States, phase 1 and phase 2. Phase 1 is basically to measure the safety and tolerability of the stem cells. And worldwide, this has been the most amount of study in stem cells, the safety and tolerability. So that has been very well described.
Would it be safe to say you've done hundreds of treatments with stem cell patients here in Panama?
Yes.
Have you ever seen any adverse reactions?
No major adverse reactions. What we have seen the most has been, like fever-like symptoms, like chills, goosebumps. And whenever you do direct injections, you basically, the swelling and pain and redness that usually, subsides within a couple of days.
Okay. What is the future of regenerative medicine? What is coming next?
I think there's a lot of interest in gene therapy. There's a lot of interest in gene therapy, and that would be one of the ways that we could probably prolong our life and prolong our tissues for longer. Regarding tissue bioengineering is something very, very interesting in where you can have stem cells and then bioengineer them into different type of tissues. So that's something very, very interesting that we want to be working on. at the moment, one of the things that we have been innovating is with patients that we can, like, we draw blood from the patient and we can expose specific markers of that blood with the stem cells. So that way you can get a basically personalized stem cell treatment based on the specific markers that are going in your blood.
And when do you use this type of treatment? For what type of diseases?
Mainly for autoimmune conditions. Because with the autoimmune conditions, we can get the antibodies, we can get all of the immune cells, and we can put those immune cells with the stem cells, and then the stem cells will start reacting specifically to those markers. Then you get the stem cells and the secretome from those stem cells, and that will be a very, very effective way to fight and modulate your immune system.
Well, personally, I can tell you that I've given directive to the lab to do further research on developing new therapeutic products, such as personalized secretomes, CRISPR-related gene editing types of applications. What else? How can listeners stay informed regarding regenerative medicine? What type of media should they be listening to?
I think there's different platforms all over the world, all over the different social media, and it's very important to take it with a pinch of salt, because not everybody is open or transparent or knows as much as you would like.
There's a lot of disinformation out there.
There's a lot of disinformation. So it's be very selective, be very picky, and do your research on the person, on the clinic, on the doctor treating, what's their background and what's their formation. Pierre, I do have a question for you.
Yeah.
What motivated you to start the company?
I've always been interested in technology. I was in software before, and the next logical progression of that would be to get into biotechnology. I never thought that biotechnology would be so interesting as it is. It's actually more interesting than any of the other businesses I've ever done that involve technology. So that was my main motivating factor. There was a book that I read called Hacking Darwin, which is amazing. And it was talking about gene editing and the future of stem cells and how that's going to help with AI to redefine therapy in all types of diseases and even reversing aging. So I thought that was really interesting.
How long ago was this?
That was about 8 years ago that I started getting interested in this. And then we started the company about 6 years ago.
For me, it was serendipity.
Okay.
In my case, because never during med school you hear anything about stem cell therapy or stem cells being used for therapy. I only heard about stem cells when I did embryology, which is basically the formation of the baby. That was the only subject that I ever heard about stem cells. So for us, doctors or people going through med school, the natural way or the natural path is to become a specialist. So I was on my way to becoming enter to the orthopedic program. And I remember my grandfather had Alzheimer's. He had 2 years that he didn't recognize me. So he had pretty severe Alzheimer's. He was, bedridden. He was barely eating, was barely drinking. He could not go to the bathroom. And twice we took him to the ER for something as simple and dumb as dehydration. He was not drinking.
He was a doctor himself, right?
He was a doctor himself as well. He was not drinking, and so twice we took him to the ER for dehydration. So every now and then I just put some regular hydration IVs or fluids in order to prevent taking him to the ER. And one of my uncles, that he's a doctor in the United States, he told us, hey, why don't you try or look into stem cells? I've never heard about stem cells. So this was, again, 6-7 years ago. And serendipity, you are friends with my cousin, and that subject came in one of your conversations. And well, perfect. The family decided, well, if it works, it works. Perfect.
Nothing to lose, basically.
If it doesn't work, at least we tried.
Mm-hmm.
At least we gave it a shot. And I remember by that time, the lab was just starting, and you didn't have a nurse or didn't have a doctor. So you asked my cousin, like, well, I can give you the stem cells, but you need to get someone to inject it. So my grandfather was actually my first patient. And with a severe Alzheimer's, with no other intervention whatsoever, just the stem cells, and that's it. Nothing more, nothing else changed. And then perfect. We put the stem cells, and then, let's wait and see what happens. 2 months later, 2 to 3 months later, I was doing again I continued doing the IV drips, and it was always the same fight. Who are you? What are you doing? Who sent you? Where's the doctor? Where's the doctor's order? What are you putting over here? And then all of a sudden, my grandfather stopped. He looked at me and he told me, "Oh, right, you're a doctor." So obviously I cried. We saw a regression in his condition. So it was not a complete cure, complete fix, but we did see a regression in his condition. He was going out of the bed. He was eating more. He was walking. He was going to the bathroom. He was going to the shower by himself. He was at his grumpiest at that time, but he was,
Aware.
So we saw an improvement in his quality of life, which was the most important part for us. I remember that was my first patient. You guys continue calling me for other patients. There was a patient with a cerebral palsy.
A young.
A 14-year-old patient with cerebral palsy that could not use his right arm. He started using his right arm. His gross motor skills improved. And then my third patient was a patient that was with a spinal cord injury in a wheelchair. And once I saw that patient walking, I was like, there's plenty of orthopedic surgeons. There's plenty. And I became in love with this. I fell in love with this type of regenerative medicine.
Thankfully for me. I think we can call it a wrap for the first episode. If you are a person who's interested in longevity, regeneration, you can just subscribe to this channel and we will get more information for you as soon as possible.